In this presentation, we want to talk to you about Attention Deficit Hyperactivity Disorder, also known as ADHD. We're going to share some information about what ADHD is, how to recognize the symptoms of ADHD, possible causes, and then also treatments and help that's available for children that are diagnosed. Before we get started, let me tell you a little bit about Arkansas Support Network. Our mission is to recognize and support every person's right to be included in the life of the community. When children with disabilities are young, we start thinking about how to support them and provide them with the resources and tools that they need to become active, contributing members of their community through their lives. At Arkansas Support Network, the Division for Children and Family Services, we offer resources and information for families, applied behavior analysis, also known as ABA therapy, for children and youth with autism up to age 21, and care and training homes for children with disabilities. Our family support program serves families with children who have disabilities up to the age of 26 and older, and provides information and training about special education services, IDEA and ADA, 504 plans, and educational resources. If your child has a developmental disability or if you have concerns about your child's development, we would be glad to talk to you and see if we can be of any assistance. Attention Deficit Hyperactivity Disorder is a common condition caused by differences or neurodivergence in the brain. People with this condition have difficulty focusing, trouble with their working memory and inattentiveness, and sometimes also experience hyperactivity and impulsivity. It's not known exactly how many people in the United States have this disorder, but the estimate is somewhere between 5 and 11%. There are 3 types of ADHD. Inattentiveness describes a child that has difficulty focusing, using their working memory effectively, and other issues relating to executive dysfunction, such as following instructions or completing tasks. Hyperactive impulsive is a type that describes when a child has a body-focused, repetitive behavior, which includes trouble staying still, speaking frequently out of turn, and interrupting others. Combined is a type that shows symptoms of inattention as well as hyperactivity with impulsivity. Children with ADHD are typically described as impulsive and hyperactive, often with behavioral problems at home and at school. A child who has ADHD doesn't have it because they are lazy, lack willpower, or being stubborn, or just intentionally refusing to do what they're being asked to do. People with ADHD are often working very hard to pay attention, control impulses, and use coping strategies to improve the ability to function more successfully in their daily lives. New research is showing that the brains of people who have ADHD are naturally dopamine deficient, so the body and mind is constantly searching for ways to meet that deficiency by trying to attain other types of stimulation. Patience, understanding, education, and the right support from family, teachers, and caregivers can provide a foundation for children who are diagnosed with ADHD to develop strategies so they can learn, grow, and advocate for themselves throughout their lives. It's important to remember each person may show symptoms to different degrees, and not everyone has every symptom. Some might disappear with age, and the experiences of each person are unique to them. People with ADHD have trouble with executive functioning skills, as I mentioned before. Examples of executive dysfunction may include difficulties with paying attention to the thing they want to do or need to do, being easily distracted, organization tasks, starting or completing tasks, especially without concrete deadlines. They often avoid, dislike, or are reluctant to do tasks that require mental effort over a long period of time, such as schoolwork. Working memory and object permanence, like forgetting your keys, your phone, or not remembering things if there aren't visual reminders. This creates challenges and can affect many areas of life, like school, work, and other daily activities. People with ADHD often have difficulty managing emotions, also known as emotional dysregulation. They feel emotions more intensely, more frequently, and more suddenly. For many, emotional dysregulation is one of the most challenging core symptoms of ADHD to manage, and it can adversely affect relationships at school, home, and work. People with emotional dysregulation are often also diagnosed with depression and anxiety. The onset of ADHD often occurs between the ages of 3 and 6, according to the National Institute of Mental Health. However, as it was stated before, some children are not diagnosed until later or even adulthood. Some statistics. ADHD is among the most common neurodevelopmental disorders of childhood as per the DSM-5. Boys are more than twice as likely as girls to be diagnosed, but research suggests that ADHD affects a greater number of girls than typically and traditionally reported. ADHD may be missed in girls because of the way their symptoms tend to manifest compared to boys, which may reflect a general bias in the diagnostic process. All genders with this disorder may show symptoms of other behavioral health conditions, as we mentioned, such as autism spectrum disorder, anxiety, depression, and also may have learning and language differences. Research to date has shown that attention deficit can be caused by several factors, such as a difference in the anatomy and function of the parts of the brain that control attention and activity level. ADHD is often hereditary and passed on in families. Premature birth, serious head injuries, and prenatal exposure to alcohol or nicotine increase the risk of developing attention deficit. And in some less common cases, toxins in the environment, such as lead, may contribute to ADHD. There is absolutely no evidence indicating that ADHD is caused by eating too much sugar, food additives, allergies, or vaccines. Getting a diagnosis can help families, medical professionals, and school staff know better how to support children who show symptoms of ADHD with or without hyperactivity. Getting a diagnosis also helps the child or adult understand themselves better and creates an opportunity for them to learn from others that have ADHD. Typically, the family doctor or pediatrician helps to start the process, so the first step is to make an appointment. From there, the doctor will refer you to a specialist if you're interested in treating with medication especially. At the appointment, the specialist will talk with you about your concerns and observations, as use questionnaires, assessments from the child, parent, and even sometimes their teacher to gather more data to make a diagnosis. If your child is diagnosed with ADHD, the specialist will talk with you about the treatment options available to see which ones might work best. They may send you back to your doctor to talk further about recommendations. Sometimes a medication is recommended, so if parents choose to go that route, they will need the diagnosis of 2 doctors. Most experts recommend using medications in combination with other coping skills, as well as cognitive behavioral therapy for treatment of ADHD. It's very important to rule out any other medical or physical conditions that could be causing the child's difficulties. An undiagnosed medical issue may be a source of exhaustion or pain that causes symptoms similar to ADHD. Any treatment plan should be flexible and focused on the child's individual needs. If parents and teachers notice that the student begins to have more academic and social success and is more comfortable and content, these are good signs that the plan is working. If parents and caregivers don't see progress after a specific amount of time, it's probably an indication that the plan needs to be readjusted. The U.S. Food and Drug Administration has approved 2 types of medications categorized as stimulants and non-stimulants to help decrease the symptoms of ADHD and improve children's functioning. These are only usually prescribed if their diagnosis has been found to significantly affect their day-to-day life in a negative way. Looking for credible resources and information to get more informed about ADHD and how it affects children is a big step in the right direction. Don't go at this alone. Ask counselors, teachers, and other parents for ideas, information, and techniques that work to guide and teach children with ADHD. It could also be helpful to talk to relatives or friends that have already experienced living with ADHD. We have included several resources at the end of this presentation that can give you more information about the strategies you can try at home. These are some tips to help your child control their behavior at home. Create a daily schedule. Limit distractions like loud music, computer games, and television, especially during school, work, and meal times. Organize your house so that your child has a specific and logical place to store school supplies, toys, and clothes. For people that have ADHD, a visual reminder or representation of something that needs to be done or addressed is the best way to tackle object permanent issues. Reward positive behavior by saying nice things, giving hugs, or using small treats for reaching goals and portraying good behavior. Define small goals that can be achieved and appreciate slow progress rather than instant results. Make sure your child understands that they can take small steps to learn how to control their actions and words. Your child's school should work with you and your pediatrician, if needed, to develop strategies for helping in the classroom. School supports may be different depending on the age and grade of the student, and most importantly, their individual needs. It can sometimes be harder for children to learn basic reading, social, and organization skills with so much more information to process, so if a student continues to significantly struggle, the school may want to step in more quickly and recommend interventions and supports that can help to get them on track. When you let the school know that your child has been diagnosed with ADHD, they should make sure all the services and supports are provided to the student so they can learn and participate with their classmates. Be sure to share reports and recommendations from the doctor or psychologist. Since school focuses on education, they don't have to follow clinical recommendations from a physician. Most of the time, schools welcome any information that can help them to support their students and will often work with you and the child. A diagnosis of ADHD does not always mean the student needs special education services, and public schools usually have a plan in place to try to help all students to participate in the general education program. A 504 plan supports students in the regular classroom with their peers during the school day with accommodations. The 504 plan is designed to protect students from any form of discrimination because of their diagnosis of ADHD. The school should monitor the child's progress very closely to see if the plan is being effective or changes need to be made. If the 504 plan is not working, it's time for the team to take another look and see if there are other accommodations that the student needs. The team may decide to conduct a special education evaluation if the student's diagnosis or condition impacts their education based on IDEA criteria. If the student with ADHD qualifies for special education services, the team will develop an Individualized education program, also known as an IEP. This plan is broader and has more power than a 504 plan and follows the rules and regulations of IDEA, also known as Individuals with Disabilities Education Act. The main purpose of any special education service is to support the students so they can participate as much as possible in the classes and activities with other students of the same grade, as well as the whole school community. With the right support, children with ADHD can have a very successful school experience. Accommodations help students to meet the expectations of the general education classroom at their grade level without changing the curriculum. Some of these suggestions include having a copy of class notes, recording lessons and course content, reducing the length of assignments, extra time for assignments and tests, having a calendar or agenda, making sure to use things like timers or visual reminders, and making sure that the student always understands instructions. If you want to take a deeper look into ADHD, you can find more information on these websites that we've listed here. Thank you so much for your time into understanding ADHD more clearly. We hope that this information in this presentation has been helpful to you, and we hope that you'll please email or call us if we can be of any further assistance.